This video empowers parents by giving them the tools to deal with their child or their teen who is having difficulties at school. It explains neurodevelopmental therapy, which is all about getting to the root of the issue and helping your child. Are you a concerned parent? Is your child having difficulties at school, maybe with learning, sensory motor functioning, or maybe there are behavioural issues? Is your little one experiencing anxiety? Or has your teenager been bullied? If so, you may be just in the right place to find the support you've been looking for. This information video has been produced by the Irish Association for Neurodevelopmental Therapists to tell you how we can support you and your child. We are a group of well-established professionals who've worked in the area of child development for decades. Some of us come from backgrounds in education, occupational therapy, various medical fields, psychology, but the one thing we all have in common is postgrad qualifications in neurodevelopmental therapy. And we have experience of working in this area for many years. To find out more about the IANDT, go to our website, neurodevelopmentaltherapy.ie, and while there, why don't you go through our screening test to find out whether NDT is exactly what you've been looking for. An NDT program is a movement-based program designed to promote brain development, to establish new neural pathways, and in so doing, provide a better foundation for your child for learning and for living, thus facilitating them in terms of reaching their full potential. My name is Aine, primary teacher and neurodevelopmental therapist. And it was through seeing the positive changes in children who are on NDT programs that inspired me to qualify as a neurodevelopmental therapist. I noticed pupils in front of me who were on NDT programs were becoming more confident, better regulated in terms of their emotions and their behaviour, and they seemed to be learning more easily. They just seemed overall more comfortable in their own skin. And of course that brought such relief to their parents. If you go to our website, neurodevelopmentaltherapy.ie, you will find testimonials from various parents who have had their children on NDT programs. So, what exactly is NDT, I hear you ask? Well, to answer that question, let's go to Sally Goddard-Blythe, psychologist, author and director of INPP International.
What we do could be described as looking behind and also beyond the symptoms, because so much of the education system tends to focus on outcomes, what a child produces in terms of achievement, and spends less time looking at processes, the developmental stages, the ways in which a child actually learns at different stages in development. So where perhaps we are different from most other approaches is that we are interested in looking at, does a child have the physical tools in place that are needed to cope with the demands of the classroom? Because just because they've reached a certain chronological age, it doesn't necessarily mean that they have developed at the same rate as the child sitting next door to them and the child who's a couple of months older, and so on. And those children who have any degree of immaturity in the physical skills that they have available to them when they start school are potentially at a disadvantage if they don't have that full range of tools in a toolbox. So what we do is we use early developmental markers to assess, is the child's central nervous system functioning at the level that we would normally expect for a child of that age. So let me go back and explain a little bit about how this is done and what these things mean. So every normal baby is born with a set of primitive reflexes which help it survive the first few weeks and months of life. And as it develops, connections from higher centres to higher centres in the brain and from higher centres of the brain downwards develop very quickly. And those little primitive reflexes, sometimes called infantile reflexes, are no longer necessary to protect them. So they are the technical term is inhibited, it's perhaps easier to think of them as being put to sleep in the brainstem, only to be reactivated if there is accident or injury to higher centres at a later stage. And at the same time as those infant reflexes are being integrated, later postural reactions are developing, which collectively will give a child good control of posture, balance and coordination in a gravity-based environment. So they don't have to think about how do they sit, how do they move, how do they get their hands and eyes to work together. The executive part of the brain says, this is what I want you to do, and at a lower subconscious level, some of those postural reactions help support those functions. So I often describe them as being a little bit like a really efficient PA to the executive part of the brain. And if the PA is doing her job well, the executive thinking, cognitive part of the brain can function really well, perform really well. But if the poor old executive is having to do the PA job and the bookkeeper's job and everything else as well, it gets absolutely exhausted and it can't perform as much or to the same level as it could if it had the good support from underneath. So we know that these little primitive and postural reflexes are normal at early stages of development. Primitives are up to about 6 months of age, and the postural should start to be developed by 3.5 years of age. So knowing that, in theory, we can start to assess the reflex status of an older child, perhaps a 7-year-old child, and see whether their reflex integration is equivalent to what we would expect at that age, or whether they are showing signs of still having reflexes from an earlier stage in development. And if they are, those reflexes are definite evidence of immaturity in the functioning of the nervous system, which can potentially affect not just balance and coordination and posture, but things like the eye movements needed to follow along a line of print when you're reading, the hand-eye coordination that's needed for writing, and the ability to recognize symbols and link them to something meaningful and then apply them in a meaningful way, which is needed for numeracy. So we need to be very clear that the primitive and postural reflexes are not the primary cause of any degree of underachievement or learning difficulty or behavioural problem that a parent might see or a teacher might see in the classroom. But clinically, they are markers that allow us to, first of all, identify, is there a problem in the physical development that is interfering in some way with cognitive skills? Identify, assess the degree of it, and use that assessment to make a decision as to what type and level of developmental intervention is going to be most useful to try and help overcome these problems. So what INPP really does is say, let's do a really good physical MOT, if you like, on this child. And if we find some problems, we can look at whether the tyres need replacing or whether there needs to be some wiring that's refixed and so on. But in the clinical program, it's very specific to the findings of the assessment in the individual child. And what we aim to do is, by giving a child a more developmentally appropriate and robust physical system on which to build other skills, enable them to start to achieve to their true level of potential. And also, if there are behavioural problems, develop better ways of self-regulation of emotions and behaviour.
So as you've heard from Sally, there is plenty of research to show that a significant number of children experiencing difficulties with learning, with sensory motor functioning, or with behaviour have neurodevelopmental delay. They lack the proper neurological foundations for a smooth school life. You can read about neurodevelopmental delay on our website, and we've outlined much of the research in that area. As NDT therapists, we work with children referred from many sources. Other professionals in the area of child development find that an NDT program can complement the work that they do. On our website, you can hear from other professionals such as Sean McDermott, who is a psychologist, from nutritionist Simon Turley. Among others, there's Marionette Brennan from the Beacon Audiology Clinic, and they all attest to the fact that they find their own clients do better if also on an NDT program. So how can you access an NDT program for your child? Well, first go to our website, neurodevelopmentaltherapy.ie, where you will find a list of therapists who are in the IANDT. They will organise for you to complete a developmental questionnaire and to come for assessment. Based on that assessment, the NDT therapist will devise a programme for your child. You will be assigned some exercises for your child, which will take about 5 to 7 minutes per day. The key to making progress is consistency. Your association with your neurodevelopmental therapist will last for up to 18 months, and your child's progress will be reviewed every 6 to 8 weeks, where your programme will be accordingly adjusted. Joe Leonard has years of experience with families who have engaged with NDT. Let's listen to Joe.
When I first went to my first talk on neurodevelopmental therapy, I was blown away by it because I understood immediately what was happening to these children. They were trapped in their development. When primitive reflexes are still present in the body, it means that part of the neurological system is delayed. These primitive reflexes should be inhibited by 2 years of age. So when they're still present, there is developmental delay. And every aspect of the child's life is affected by it. If you are a parent and what I'm saying resonates with you, if your child is delayed in learning to ride a bicycle, if they're not progressing through the swimming classes like the other children, if they're not enjoying sport, if school is a struggle for them, then you are on the right track to approach this therapy. Neurodevelopmental therapy is lovely because it's done through movement, which is a great break for a child who is laden down with homework. Because these children often get extra homework because they wouldn't have finished their work in school. So if what I said has resonated with you, don't delay, act on your gut instinct. I'm sure you won't be disappointed.
You will find an IANDT therapist on our website, neurodevelopmentaltherapy.ie.